Hi everyone, and thanks for joining today. I'm Kim Phillips, Head of Customer Operations at Tyro Health. Today I'll be walking you through the upcoming Medicare bulk billing changes, specifically focusing on electronic assignment of benefit and what this means for your practice. Before we dive in, here's what we'll cover in this session. First, we'll take a look at what is actually changing and when. Then we'll look at how electronic assignment of benefit works with Tyro Health. And finally, what you need to do to get ready ahead of 1 July 2026. The key thing to keep in mind throughout today is that these changes are already supported on Tyro EFTPOS machines, and there are simple ways to prepare now. One of the biggest questions we're hearing is whether these changes require a complete redesign of Medicare claiming workflows. The short answer is no. Assignment of benefit itself isn't changing. Patients have always needed to assign their Medicare benefit to the provider when the service is bulk billed. What is changing is how that assignment can be captured and recorded, specifically the move toward electronic options. There are also new supported workflows, including the ability to capture assignment of benefit either before or after the consult. Where we're seeing potential challenges is how practices manage this operationally. If assignment of benefit isn't captured as part of the claim submission flow, it can introduce extra steps, for example, needing to collect and record consent separately. That can lead to things like managing additional authorization steps, extra follow-ups, delays in payment, and increased workload for front desk and billing teams. So while the requirement itself isn't new, the way it's handled can create additional admin if the process isn't streamlined. The good news is that an electronic assignment of benefit is already supported with Tyro Health Medicare Easyclaim. For practices using our solution, assignment of benefit can be accepted electronically. Both patient and provider copies of the assignment advice can be printed, and importantly, the assignment is recorded electronically with Services Australia for auditing purposes. This is already available for PMS-initiated bulk bill transactions on both our countertop and our mobile EFTPOS machines. We're also expanding this later this year to include both PMS-initiated and standalone transactions on the Tyro Health Pro Key devices. Let me walk through how this works in a typical workflow. After a patient's appointment, the bulk bill services are explained as usual. When the claim is sent from your PMS to the Tyro EFTPOS machine, the patient is prompted directly on the screen to assign their benefit with a simple yes or no option. If they select yes, the claim is processed. The assignment advice is sent to Services Australia and a copy can be printed. If they select no, the claim doesn't proceed because assignment is required for bulk billing. So the key benefit here is that assignment of benefit is captured seamlessly as part of the claiming process without needing separate steps. So if you're looking to start using Medicare Easyclaim with Tyro Health, the process is straightforward. First thing to do would be to check whether your PMS integrates with our Medicare Easyclaim functionality. We support over 100 integrations, so it's likely that it is. Then simply enable bulk billing via Tyro Health in your PMS. There's nothing to do in Tyro systems. This is all done within your practice management software. And importantly, if you're already using another Medicare integration, there's typically no additional Services Australia registration required. And that brings us to the end of today's session. If you have any questions or would like help getting set up, our team is here to support you. You can reach us via phone or email, and we're happy to walk you through your current setup and any next steps. Thank you again for your time today.